but they have the sovereignty, so we can't force them to take our...
World Health Organization Chief Tedros Ghebreyesus says our work is not over to contain hantavirus after evacuations from a cruise ship hit by a deadly outbreak of the illness. The fate of the MV Honduras has sparked international alarm after 3 passengers died in an outbreak of the rare virus, for which no vaccines or specific treatment exist. Yet health officials have stressed that the global public health risk is low and rejected comparisons to the start of the COVID-19 pandemic.
They have the sovereignty, so we can't force them to take our protocols. We can only advise and recommend, but I hope they will follow the advice and the recommendations we're making.
More than 120 passengers and crew of the MV Honduras were flown out from Spain's Canary Island, and countries have adopted different health measures for their returning evacuees. Most countries have followed the WHO's guidelines, which include a 42-day quarantine and constant monitoring of high-risk contacts. But in the United States, Jay Bhattacharya, acting director of the Centers for Disease Control and Prevention, CDC, says American passengers would not necessarily be quarantined. The MV Honduras presented diplomatic challenges as different countries negotiated over who would receive it and treat its passengers. Cape Verde refused to receive the ship, which remained anchored offshore the capital Praia, as 3 people were evacuated to Europe by air last week. Spain allowed the vessel to anchor off the Canary Islands for the evacuation of passengers and crew, but the Atlantic Archipelago's regional government fiercely opposed the measure. Defending his government's policy, Sanchez says the world does not need more selfishness or more fear. What it needs are countries that show solidarity and want to step forward.